Hi, my name is Dr. James Glynn. I am a clinical and sports psychologist. I am wanting to talk to you guys today about pre-surgical bariatric psychological evaluations. I conduct a lot of these in the practice, and oftentimes patients come in and they are nervous and concerned and unsure about what to expect. They're often curious as to why they have to go for a pre-surgical psychological evaluation. So I want to just take a little bit of time just to explain what the process is, why you go through the process, to hopefully give people a little bit of a better idea of what to expect, so maybe calm some of the nerves that people experience. Now, first things first, going to see a psychologist is obviously very nerve-wracking for people. They're wondering what sort of questions we're going to ask, what sort of things we're looking for. Will we approve them for the surgery? Will we not approve them for the surgery? So, first of all, the way I see my role as a psychologist in the process of people going for bariatric evaluations is to help provide information to make your process of post-surgery process specifically much more smooth and likely to be successful. My job really isn't to fail you or tell you you can't have surgery. It is really just to provide information to you and your surgeons of anything that might be helpful to know going forward, and making sure that you have all the information you can to make good decisions post-surgery. So when you come to have an evaluation in my practice, what you would do is you'll come, typically we'll have you fill out some paperwork, some psychological evaluations, very brief, not threatening at all, just to kind of get a baseline assessment of where everything's at. We screen for depression, we screen for anxiety, we screen for any alcohol or drug addiction issues, we screen for body image stuff. We discuss about support systems that you have, things kind of like that. Then once you've completed the evaluations, you'll come in, you'll have an interview with us, and during the interview we'll ask things about medical history, what your support system is like, previous attempts you've had at dieting and trying to lose weight in the past. Some of these will include different diet plans, prepared meals, liquids, any prescription diet, any prescription weight loss pills you've tried, any over-the-counter weight loss pills you've tried. So those sorts of things we'll be doing. Any exercise regimens you've been on, whether you've had a personal trainer, whether you've worked with a nutritionist before, lots of things kind of like that, just to kind of get an idea of where you're at in the process, what things you've tried, if anything's been successful, not so successful, and things like that. We'll also ask you if you understand the procedure. You don't have to have like a big knowledge of the procedure, but you need to have a sort of a general understanding of what it is that you're kind of going for, and what the procedure is like, what the recovery is like, all of that type of stuff. We'll also ask you whether you have been told about all the different rules, specifically things like whether you've been told that you can't drink carbonated drinks once you've had surgery, whether you've been told that you can't eat and drink at the same time after surgery. Normally there's a 30-minute before and after eating rule where you can't drink in that period of time. We'll also ask you about any history of any addiction issues you may have had, so we can have an understanding there. Again, nothing too in-depth, nothing too crazy, just general stuff, just to make sure that everyone is ready and able to go on with the procedure. We'll also discuss the importance of exercising after the surgery. We'll discuss the importance of making sure you chew your food thoroughly, making sure you take your time with your meals, making sure you understand that you have to eat a high protein diet, all kind of things like that. And then once we've kind of gone over that, we'll discuss any questions you may have. Sometimes people have questions, sometimes people don't. It's okay if you don't. And then once we've done that, we'll share some of our kind of insights into and our experiences about working with people, some things to look out for after the surgery, a few little tips and tools maybe that can be very helpful with you. And then once we're done with that, normally 9 times out of 10, we give straight approval. If we have seen anything in the evaluation, like there's any depression or any anxiety going on, or you've reported a history of stuff, all we'll do is we'll discuss what you need to do maybe about that to make sure, again, it doesn't impact your recovery from surgery. And that's really our main goal here, is to make sure once you've had the surgery, you have everything available to you to be as successful as you can and reach your goals that you've set out. We'll also discuss with you the importance of following up after surgery, and following up with support groups and things like that. Okay, and that's kind of what the psych eval involves. We then write a report about everything we discuss and all of our test findings and things like that, and we send it to your surgeon. Typically they get it 24 to 48 hours after we've seen you, so it shouldn't hold up the process. If there's any special requirements, and some people come and they're needing the report kind of the same day, we can do that, and always let us know. But that's basically the psych eval. Again, it's designed not to be threatening. It's designed to be informative. It's designed to just, from our point of view, just to make sure that everyone's researched it and understands it, and has a good plan in place for after surgery. And once we've discussed that and we've got a good idea of that, we're more than happy to approve you for the surgery. So that's basically the psychological evaluation. I hope it was helpful. I hope it was informative. I hope maybe it put some of your anxieties and fears to ease about coming to the evaluation. If you are planning on coming in for a psych evaluation with myself or my partner, Dr. Sakowitz, you can look forward to hopefully an informative process, and one where most patients walk away feeling like they've learned something new and feel like it was a worthwhile endeavour that they went on. So thank you for taking the time to watch this video, and I wish everybody who's going for bariatric surgery lots of luck, and hopefully they'll achieve the goals that they set out to achieve. All right, thank you.